How's everybody doing today? Here's a quick case of an abnormal common femoral vein flow. This patient was a 63-year-old male who presents with a 2-day history of right leg swelling with acute onset. He also had right calf pain upon firm palpation. He had no history of prior DVT or superficial venous thrombosis. However, he did have a history of malignancy. He also had a fairly extensive history of arterial disease, as can be seen. Here's his left common femoral vein. You can see a spontaneous flow with a significant degree of respiratory phasicity and a good response to deep inspiration in the lower right-hand side. Contrasts very dramatically with the right side, a very continuous flow in the common femoral vein with really no response to inspiration, similar to the profunda femoris vein. In the lower right-hand side, in the femoral vein, a continuous flow. We do get some minimal response to a calf compression. Moving distally, we find a patent right popliteal vein with certainly abnormal, really diminished flow. We do get some response to calf compression in the upper right-hand picture. Upon evaluating the calf veins, we find what appears to be an acutely thrombosed peroneal veins, evidenced in particular by the incompressibility in the transverse images to the right. Now, this would certainly explain the patient's calf discomfort, but clearly not the abnormal outflow we noted in the common femoral vein. Upon returning to the groin, we note also a number of rather prominent lymph nodes. Now, in our practice, we tend to measure and report these, even though they are a rather common finding. So when you see a waveform in the common femoral vein like we showed you previously, that should shout, "Look proximal." There's an obstruction there. So that's what we did. Here's a color Doppler image as well as a spectrum from the inferior vena cava. This appears to be widely patent. So let's take a look at the right common iliac. Let's take a look at the right common iliac, which also appears to be widely patent. Note the spectral waveform, somewhat pulsatile, but certainly a widely patent common iliac vein. So how many of you knew what was going on? The lymph nodes in the groin were kind of the key. And in fact, this patient had a number of large lymph nodes within the pelvis as well. And in fact, here we can see a lymph node largely surrounding or directly adjacent to the right external iliac vein. Look at that fairly continuous flow, velocities near 200 centimeters per second through that stenosis caused by that extrinsic mass. So remember, a venous waveform that looks like this, no matter which vein or what level you encounter it, is shouting, "Look proximal." Now go out, do right by your patients, and have fun, everybody.